Health insurance can be hard to understand, especially for those Coloradans who've never had insurance before. If you're confused about what a copay, coinsurance, deductible, enrollment fee, and premium mean, you're not alone. This video will help you understand the basic concepts of health insurance. Because of the new laws passed by Colorado and the federal government, we're in the middle of the biggest healthcare changes our country has seen in nearly 60 years. New insurance plans created by the Affordable Care Act are designed to help provide better coverage, and new financial assistance is available to help lower the cost of health insurance that is purchased on Connect for Health Colorado, our state's insurance marketplace. You can still buy insurance outside of the marketplace directly from an insurance company or insurance agent, through your employer, or if you qualify, you could get free or low-cost health insurance from Medicaid or the Child Health Plan Plus. Even though coverage and rules have changed, the basics of insurance are the same. You could have premiums, deductibles, coinsurance, or copayments depending on the kind of health insurance you choose. We'll spend the rest of our time together learning about what those terms mean and how they work. Typically, you will have to pay your insurance company a monthly premium. A premium is the money you pay to have health insurance, and this amount is often shown as a total yearly amount. However, premiums payments are usually paid on a monthly basis to your insurance company. This way, you don't have to pay it all at once. Many plans require you to pay a cost called a deductible. A deductible is the amount you'll have to pay for many medical services before the insurance company will cover the remaining costs. For example, if you're in an accident and your medical costs are $3,000 and you have a $1,000 deductible, then you have to pay $1,000 out of your own pocket before your insurance company picks up and pays for the remaining $2,000. However, if the medical costs are only $1,000 and you still have a $1,000 deductible, then you will have to pay the entire $1,000 on your own. Typically, the deductible is an annual amount. For plans that have a deductible, many also use coinsurance. This is a shared payment between you and the insurance company for a medical service. For example, if you've reached your annual deductible amount, meaning you've already paid that amount out of your own pocket for medical services, you will share costs for medical services with the insurance company on an 80-20 basis. This means that you will pay 20% of the costs, while your insurance company pays 80%. Coinsurance is usually talked of as a percentage. Some health plans use copayments, also called copays. When you visit a doctor's office or receive a covered health care service, you could pay a fixed amount called a copayment. The fixed amount of the copayment will vary depending on the service. For example, you may pay $25 every time you go to the doctor's office, and $10 for every prescription. How much you pay for each service depends on the plan you choose. Some plans may use copays for all or most medical services, while other plans may use copays for only a few services. It may seem like you'll be paying a lot of costs for health insurance with premiums, coinsurance, copayments, and deductibles. But the new coverage protects you in many ways. Each plan has an out-of-pocket maximum. This is the total amount you will have to pay on your own in a policy period, usually a year, before your health insurance begins to pay for 100% of your medical costs. However, this out-of-pocket maximum does not include the premium you pay to the insurance company. There is also no cap or limit to how much an insurance company has to pay for you. So once your out-of-pocket maximum is reached, the only thing you'll most likely have to continue to pay is your monthly premium. There are also new government subsidies and tax credits to help reduce the overall cost of health insurance for individuals and families. Go to connectforhealthco.com to find out if you are eligible for these subsidies and credits. If you do not have private insurance but are enrolled in public health care, like Medicaid or the Child Health Plan Plus, you will pay even less for coverage. This free or low-cost coverage is for low-income Coloradans that qualify and includes many of the same and sometimes more benefits than private insurance covers. If you are enrolled in Medicaid, the only thing you'll have to pay is copayments in some cases where you need covered health care services. To find out if you're eligible for Medicaid, go to colorado.gov/peak. If your child is enrolled in the Child Health Plan Plus program, the only things you will have to pay for are copayments and an annual enrollment fee. This is a small fee you pay when registering and entering your child into the program. Unlike a premium that is monthly, the enrollment fee is a once-a-year payment. To find out if your child is eligible, visit colorado.gov/health or cchp.org for more information. If you have more questions about how health insurance works or are still confused, visit colorado.gov/health for more information or call the Division of Insurance's Consumer Affairs line at 1-800-930-3745. This video was produced by the Colorado Department of Healthcare Policy and Financing in collaboration with the Division of Insurance and Connect for Health Colorado.